So I've taken a little bit from last week's presentation and put it in together tonight so that we can help you prepare yourselves for when your loved one comes home, when they complete a treatment and when they come home. And this really applies, I think, to any stage of treatment that they finish. If they just do the inpatient in Northcliffe and do the 24 days and go home, or if they go to the long-term treatment and then skip the halfway house and go home, or when they finish primary and secondary and they go into the tertiary care and they're having more interaction with you, preparing them to go home, I think these all apply. So I'm just going to go through what Dom did briefly go through last week. And Christian and Dom are going to jump in when they see fit, when we need to. So please remember that relapse is a process, it's not an event. And in order to understand relapse prevention, we have to understand the stages of relapse. And it starts weeks or even months before the event of physical relapse. And we hope that we can assist you in learning how to cope if it happens and how to prevent you from relapsing as well. So I think that's the key for me, is so many of us, the family members, we often relapse either before they come home or we relapse when they at home. And what do I mean by relapse? I think it's about returning to the same behavior that we had prior to booking them into treatment. So it's the insecurities, it's the policing, it's the feeling inadequate, the chaos, the lies, the deception, the stealing, etc. And we still raw and fresh from that, even if they've been with us for 12 months. I think it takes us a very long time to prepare for when they come home, because we are confused. We either didn't attend enough family support. They're manipulating us still. So, I think our preparation is key in preventing us from relapsing. And then, God forbid they do relapse, it's how to deal with that. So I'm going to share a booklet that most of you should have. We send it out to you when you get your collateral letter. Some people may not have it. If you don't, please send me a text, an SMS with your email address, and we will forward it on to you tomorrow. So we sat down as a team and I decided we were going to hand out a booklet to all the families who book patients into Changes, from my own experience and from experiences of others, on how to actually help you when they come home. But we're going to work through it now collectively. So your loved one has completed treatment and is coming home. What now? I think you can all relate to that panic and anxiety, that they're coming home, they're at home. What do I do? Am I prepared? Have I prepared enough? Has the team prepared me enough? And I think, truth be told, I don't think we can ever really be fully prepared for when they come home. So, okay, we start off by acknowledging how scary it is and confusing. And we encourage that you hold on to this booklet and read it regularly to find encouragement, support, clarity, and insight into what it's like living with an addict or alcoholic after they've completed treatment. I think the first thing that we need to bear in mind is that when you first bring them in, the whole family's in chaos. You probably don't remember the drive-in, the anxiety, talking about the finances, talking about their medication, what to expect, who's going to do what. So it's like a whirlwind for most of us. And then I think the first 3 weeks, we start breathing a little bit, relaxing a little bit, and thinking, okay, so, if this does work, what does that look like? And if it doesn't work, what does that look like? And if most of you are like me, I did not like hearing that relapse was a possibility. I'm paying for this once. I'll do whatever they ask me to do, but you've got no options of relapsing. And that's not tangible. It's not achievable, because sadly addicts can relapse, and sometimes they do in a horrific but spectacular fashion. And then what do we do? So I think the first thing that I'd like to mention is the importance of dealing with your own trauma. And that could mean family support groups. It could mean going to see your own private therapist. It could mean joining a tough love, a co-anon, Al-Anon, or Nar-Anon meeting, talking to other families who have got loved ones in treatment. I think that happens a little bit more at the River Manor, because patients are there a lot longer. Parents get to meet each other, have lunch sometimes. They do swap telephone numbers, and it's important to speak to people who've been through it with you. Most of us make many mistakes when they first come home, and don't expect not to. I think we put a lot of pressure on ourselves to do everything perfectly to avoid the relapse. We just will do absolutely anything to not have them go down that rabbit hole again. Okay. Dom, Christiane, is there anything you want to add yet?
We unmuted. Yeah. Sorry. Yeah, I just want to add as well, something that Sheryl touched base on, is that it's a very common sort of misconception that if your loved one comes into treatment for 21, 24 days, they're going to be cured, and they're going to be fine. Or no, it's just a psychological or psychiatric issue, they're medicated now and they're fine. Because I think there's such a lack of understanding around the disease of addiction. It's something that's rife. It's something that's very common. It's something that's taking out our communities and our, and people in schools, especially now with the younger kids. I think it's very, very common. And there's just this misconception around what addiction actually is. And people are under the sort of pretenses that, well, if you go to rehab, you get seen by a psychiatrist, they put you on some medication, you get some counseling, you're going to be fine. I think the lack of, I don't want to call it, it's just, I think, a lack of education as well, that it is a lifelong disease. It's the same as having cancer or diabetes or a heart condition. It's progressive and it can't be cured, but it can be managed. And I think people don't understand. I think that's where there's a big lack of understanding, in the sense that it's a lifelong disease that needs to be managed. It's not something that can just be cured in 21 or 24 days. I think that's what I wanted to add on that part.
Yeah, very appropriate. Thank you, Dom. Okay. All right. So we're going to move on. Please, as questions arise, please feel free to type them in, because then we'll answer them from time to time. So I think that the fears that we have, and the insecurities are, what happens now? What if they relapse? How do I help them stay clean and sober? And what is my new role and responsibility? I remember, and I was saying to the team earlier today, I remember the first rehab in particular, but quite a few thereafter. I used to say to everybody, I could cope with their using because I knew what I had to do. I knew what those boundaries were. But what I didn't know was how to live with somebody clean, and what changes I needed to make, because they were going through these changes. They had treatment, they had a sponsor, they were going to meetings, doing step work. But we were still stuck in the fear and the what if. It was always, what if he relapses? What if he doesn't come home? What if he, is going to coffee after a meeting? What if he doesn't come back? It's always those what if and why and what questions that I think cripple us and freeze us. So I think the first thing is to acknowledge that addiction is a family illness. So either there's an addiction in other family members, or the addict uses the drugs and alcohol and the family members get ill in response. I know I didn't like to hear that, because it made me feel like, what could we have done differently, and what have we done to cause his addiction? Hindsight, I've probably got about 45% of my family members who are addicts, and who've had horrible lives because of addiction. But when we were going through it, we didn't want to talk about it to anybody. Our family members didn't know. We didn't understand the hereditary link. But they would take the drugs and we would get sick. Addiction is a no-fault disease. It's recognized internationally as a brain illness, and any appropriate treatment can place it into remission. And I think that's what Dom was touching on. We get a lot of challenges in treatment from probably half of our family members, because they really believe that if we address the psychiatric issue, we deal with some trauma and psychological issues, they're going to be okay. But, you know, my supervisor did a thesis in the 80s where the label of his thesis was psychology as part of the problem. And what he was trying to educate communities and professionals is you can't psychologize addiction away. Addiction needs to be treated in a biopsychosocial way, which means they've got to stop using. They have to be investigated for an underlying psychiatric illness. Where appropriate, take medication as non-addictive, and then deal with not initially what caused them to use, but what trauma did they suffer through their using and their addiction, and then what trauma did they cause the families, and how do we help them interact back into a social environment. And I think it's taken South Africa probably 35 or 40 years to really understand that it's a no-fault disease. It is automatic. It is permanent, but it can be arrested, treated, and recovery is possible. But for somebody like me who's been in the industry for 30 or 40 years maybe, the biggest difference we've seen in the treatment of substance abuse has been the introduction and the strength of the 12-step program. In the 80s and the 90s, people were not recommending NA and AA. They weren't subscribing to the 12-step fellowship. They weren't insisting that they go. They weren't introduced in treatment centers because people didn't think that it could have much value. That we treated addiction in the 80s as a medical condition. So people would have detox, 1 or 2 weeks of a little bit of counseling here, and wrap over the knuckles, don't use drugs again, and they would leave treatment. Most people in those days would start drinking so that they didn't have to take their drugs, but very shortly thereafter they would resort back to their substance. And I think only the introduction of Narcotics Anonymous and the activity that it created did we understand that it was abstinence from mood and mind altering substances and taking the appropriate medication to help them recover. The brain needs medication in order to heal. We get a lot of flack from our patients with medication, and I'm sure they tell you when they phone, you know, it's always a conversation or a complaint about medication. But for us, it's an integral part of the therapeutic and treatment process. Also, what we have seen is when there's a lot of family participation in recovery, which means attendance at family support groups, going to Co-Anon and Ar-Anon and Tough Love, we definitely see a much higher increase in the addict and alcoholic opportunity to get better. So the more education, the more insight, the more knowledge, wisdom that we as family members get, we actually that's helping our loved ones to get and hopefully stay in a long-term recovery.
Sorry, Sheryl, there's some comments here from Kobati. Not very encouraging to hear. We are here for the long haul. And then there's one that she says, please say more about how you use medication as part of recovery.
Okay, great questions. And I think, Kobati, it's exactly how we all feel. when we first joined, or in the first 6 or 8 weeks, I think, of us attending, because I think we really do believe that once we've put them in rehab and we've invested all this time and money and energy and hope, that there's a possibility that they can relapse. But think about it this way. If we compare it to diabetes, very few people are born actively diabetic. It's our lifestyle that gets us to that point. And it takes us years until we are diagnosed with diabetes. And addiction isn't isolated. So people have been using for years or months. And sadly, once they become an addict, there is a chemical change on a cellular level in their brain. So that is why they have to be treated and participate in active recovery for numerous years. I have clients who are 18, 19 years clean, and they still do at least one meeting a week, or they meet with their sponsor every week. They don't crave, they don't want to use, but they need to participate because their mind still needs treatment. And that treatment is taking responsibility, talking about it to a peer, talking about it to fellow recovering people, and practicing this program, which is like a spiritual program to take responsibility and get humble. So it's not to say that 25 years down the line, you're still feeling like you're feeling now and they're feeling how they're feeling now. But from my own experience, it took 2 solid years for recovery to become sustainable. But I've been at this since the 80s, and my loved one only has 8 years clean. So we did many dances in rehabs over and over and over again. But the biggest problem for us was we didn't listen to the treatment centers. We didn't listen to the advice they gave us. We didn't believe them. We wanted to bypass and get better quicker. And we often listened to them, who were still dishonest, in denial, and highly manipulative. So we have to prepare you, because it's the responsible thing to do, that we're in it for the long haul, but it's not trauma all day, every day for the long haul. There's a lot of hope. Okay, please say more about how we use medication as part of recovery. I think we're going to cover that in the next couple of weeks. We're actually going to ask our doctor to do a workshop. So I don't want to go into that too much, but when they come in, we use medication to help them detox, to prevent seizures, to prevent organ failure, and to prevent organ damage, further organ damage. So we use detox medication first, and that changes from patient to patient. But generally, we have a regime for different substances. The drugs that we battle the most with in treatment is alcohol. Rapid withdrawal from alcohol is highly dangerous, and they require more medication than most. And then the next hardest drug that we treat is marijuana. So we find that anybody who has been smoking marijuana, they tend to get medication for a longer period of time because of the severe consequences and side effects that marijuana causes. But each patient will see a psychiatrist. It's generally only one appointment for the psychiatrist, and that's purely because of time. Once the diagnosis is in place and the medication has been prescribed, generally most patients do not need to see the psychiatrist again too frequently until their follow-up, which is about 6 weeks. I know most of our patients, and you'll probably hear it, they say that every patient gets diagnosed as bipolar or ADHD, or they all get a certain kind of medication. And that's not the case. Our doctor really tries hard to look for, not to find those psychiatric illnesses. But there's some things that we have to consider. The first one is family history. If there's a family history of substance abuse and bipolars, psychiatric conditions, there's a possibility it's been passed down. Medication is there to help stabilize them. And when they're stable, they sometimes don't feel the urge to use drugs or alcohol again. So that, in conjunction with the 12-step program, the group therapy that we offer, the individual counseling, the sponsor, the 12 steps, the outpatients, the inpatients, the halfway houses, that is what we mean by the biopsychosocial process. So every aspect of it is as important as the next, and one doesn't or shouldn't supersede the other. Like, I know a lot of people who just go to 12-step meetings and they're clean, but they're not better. They refuse to take medication. I know people who only take medication, refuse to go to 12-step meetings, and can't stay clean. I know people who challenge the doctors and refuse the medication and challenge the treatment team and the sponsor, and they don't stay clean, because recovery is a holistic approach and there's many factors that key into it. So medication is one part, therapy is one part, 12-step is another part. And as we put all those parts together, the machine then starts to work smoothly. But one shouldn't exclude or supersede the other. Okay, if I could carry on. And Dom, I'm reading off the screen. I can't see all the participants. So if you guys need, please just put your hands up.
No, that's fine, Sheryl. Sorry, our cameras died, but we can still hear everyone.
Okay, all right. No, that's fine. Okay. Ensure that you've been part of the treatment process. If not, it's never too late to join a family support group. I am a huge advocate for family support group, because I think that everybody knows somebody who's been on drugs. Everybody knows something. But until somebody has lived through it and in recovery from it, which means that my life is getting better, my behavior is improved, the addict or alcoholics getting better, their life's improved, I want information from those people. I don't want to hear from every Tom, Dick, and Harry at a dinner party, oh, so-and-so's child went to had a drug problem, he went to this rehab, that rehab's terrible, that rehab's awful, you got to try that rehab. That's not what recovery is. Recovery is about learning new ways to cope and not policing them and searching them and testing them. It's about how to heal and how to grow emotionally and take responsibility for ourselves, not focus just on them and not look for these quick fixes. And support groups will give you the best comfort when you hear people say, my loved one is in recovery. It did work for me. This is what I had to do in order for it to work. Okay, the benefit is immense. It will help you understand the disease of addiction, learn the tools to help you cope in a healthy way, and it should help you work on your trauma, your fears, control issues, and manipulation. And yes, the family members also manipulate, lie, cover up, control, use toxic methods of dealing with a using addict or alcoholic. You may not want to accept it, but it's the truth. And this is our responsibility to address our behaviors if we want to help our loved ones stay clean. I know that we may not directly tell you this in a conjoint or in a phone call, but when you can acknowledge your own manipulation and dishonesty and toxicity, that's when you can work on it. I didn't want to believe that my helping them was toxic. I didn't want to believe that we were part of the problem, a contributing part of the problem. When I heard you didn't cause this, you can't cure it, you can't control it, but you're contributing to it, I felt like I'd been punched in the solar plexus, because what do you mean I'm contributing to it? When I really sat down and looked at it, we manipulated them. We would bribe them to stay clean. We'd bribe them to not go out. We would tell them stories. We'd threaten them, you're going to be the cause of mommy's heart attack. You're going to be the reason that our parents split up. It meant nothing to the addict. But for us, it was toxic. It was unhealthy. Addicts use because they love to be high. We contribute to that by enabling, by manipulating, by our dishonesty, but we don't make them use, and we can't stop them using. But we have to take responsibility for what's our unhealthy coping skills. What of those do we need to change?
So Sheryl, I just want to add on to that as well, and it boils back to what you said earlier about this being a family disease, is that, you know, when somebody comes in to treatment, the family sort of take a step back and go, okay, well, my loved one is in rehab, they're safe, they're getting the help that they need, and sort of, I don't want to say assume, it's quite a hard word, but just assume that when my loved one comes out, everything's going to be fine.
And they don't have to do any of the work, any of the self-awareness, self-discovery in terms of what actually was my role. Yes, you didn't cause it, and it is a no-fault disease. Of course you didn't. And they're the addict. They have a lot more, I'm sure, consequences than you are experiencing. However, your role just in surrounding them, just in how you engaged with their behavior, if you lied to cover up one time, if you know, or whatever the case is that's the stuff that you need to look at in terms of your own denial, in terms of how you have engaged with their behavior. Yeah.
And I think it's so important as well, you know, like Christiane saying, like, how have you contributed? How have you not contributed? What can you do better? What support do you need as a loved one? You know, you need to look after yourselves as well, you know, and that means by whether it's attending these family support groups or going to like Al-Anon or Nar-Anon or even Coda. It's very important for the family members to also get help, because remember, you guys you've been affected by your loved one's addiction, whether you want to admit it or not. Some people say they're fine, but they aren't. You know, you need to get that help that you need and that support that you need so that you're able to have this person back in your life, if that makes sense.
In a way, we read that it's hard for us to see how we manipulate, lie, and cover up. It's very painful to look at yourselves in that way. I remember in one treatment center being asked to write my life story. And the whole life story was about my addicts. I didn't feature in it. And they pointed that out. And then, you know, obviously I then went on to do a lot of 12-step work. But that aha moment when we realize that we've contributed in such a loving way, but for them to get better, we have to change. And I think we all focus on the changes they need to make, but it's really painful to look inward and look at what changes do I have to make. At this point, I also want to say something, because tough love gets a very bad rap. And people often use the word, I practice tough love. And I grew up working tough love. I worked for them. I was their chairman for many years. I did all their training. I trained overseas. And if you're not going to tough love meetings and working in a tough love group, you're not practicing tough love. Because tough love is not an action. It's not something that, okay, because you kick them out the house, you're practicing tough love. That's not what it is. What we're asking you to do, change yourselves, get deep inside and look at where am I going wrong, and then executing boundaries. That's tough, because we have to do it with love, and because we love them, it becomes very tough. So I do encourage people to go to the tough love program, but if you're not, please refrain from saying I'm practicing tough love, because it's a very guided, healthy process that does help people, addicts and their families. But it's not because it's cruel, and it's not because we do all the hard stuff.
Sorry, Sheryl, there's another question from Kopadi. It's how will we know what changes we must make? Do you provide this for families in your care? So I think we have answered that in terms of, you know, attending the family groups and going to tough love meetings and that. And then obviously, you know, if there's any additional resources that you would require as a family member, you can speak to your counselor about what support you need, and we'd be able to assist you from there.
Yeah. And the answer would be no, because it's such an ongoing process. And no matter what information we give you in the first 3 to 6 months of being in treatment, it may not all be applicable. So it's part of the recovery process and the need for going outside for extra support. It's a common factor that after treatment, families find many excuses to not continue with family support or get tired of participating in recovery programs. Yet they still expect their loved ones to continue with their recovery and stay clean and sober. We need recovery just as much as they do. I think, you know, right now that we're running this on Zoom, we definitely have more families on it than used to come to face, because it's a little bit easier to doing it from the comfort of your home. We're not traveling in the dark with load shedding, etc. But this group should have at least 2,000 people on it. And the proof is that people get tired and they think, ah, well, you know, it's his problem. He must get on with it. I've done enough work, but it's an ongoing struggle and journey. Before they come home, take a good, long, hard look at how you have been living and take stock of the role that you have played in their addiction. We're not saying you need to take blame for what has happened, but we're saying it will help you take responsibility for how the addiction was allowed to continue and last for as long as it did. Didn't cause it, you can't control it, but you unwillingly contributed towards it, and that did not work out well at all. So what we really mean by that is our love and our excuses and our manipulation and our toxicity was part of the problem. My family, I went to tough love. My parents never did. And my loved ones would play my parents off against each other. I would then get very aggressive and defensive because I was protecting them. So I would fight with my siblings. My family would feel sorry for the addicts. They would overcompensate. They would give them what they wanted. It was fighting all day, challenging all day. And all that happened was the addicts got to use their drugs without consequences. So that was one of the ways that we unwittingly contributed. When the recovery started, there was no more blame game. There was no more triangle of you did this, you did this. It's like we all screwed up. We lived appallingly, and we have to do things differently if we want to get better and if we want to help them get better. We know that the first few nights that your loved one was admitted into treatment, you either slept properly for the first time in years or you didn't sleep at all. Your mind was racing, you felt absolutely shattered. This is understandable and very normal. However, this is not the time for you to hibernate. Take a few days to gather yourself. Do what some self-loving things that you need to do. But then you need to take that strength and start working. It means that you stop feeling sorry for your loved one, you stop feeling sorry for yourself, and you start your process of healing and getting better. Get a journal and start writing in it from day one. Make a list of the carnage you've been living with. List all the financial losses, emotional traumas, and the mistakes that you have made. Not their mistakes, your mistakes. Whilst they're in treatment, you can ask them permission if you can go through their room or home and start clearing it of drugs, paraphernalia, alcohol, and other dangerous objects. However, you do not need to, and please don't clean it up. Taking the drugs out and emptying out the dustbins, that's fine. But if they've left it in a mess, you can leave it. You do not have to clean it up, because it's something they have to face. And you can say to them, I've cleaned it out of paraphernalia, but there's a mess for you to clean up when you get back. It's okay for them to come home and clean it for themselves. Clear your own home of alcohol, pills, and other triggers that may be there, particularly if they're in the halfway house and they're popping in and they're visiting and having lunch, etc. Many families take umbrage to this. I don't have a problem. Why should I stop drinking? If you are saying something like that, then you might need to ask yourself, is my drinking a problem? Because most people who don't have a problem with alcohol, they can stop to help their loved ones. Very hard for, I think, families to look at their own substance use and see, is it problematic or not? Not drinking should not be a problem for you unless it's a problem for you. Not drinking is healthy. It keeps your loved one, it helps them with their recovery too. There will be many consequences of your loved one's addiction that will become apparent in the wake of their stopping using or drinking. It is not your responsibility to clean them up. No matter what your excuses, the only responsibilities that need attention from you are if they've got children, if there's aged families involved, and if there's animals. And this means that the children need to be taken care of, and if necessary, the authorities need to be called in to assist. The aged need to be taken care of, and arrangements for this can be made. And animals rely on us to survive, and we either take them in, surrender them to shelters, or rehome them. For the rest, leave everything else for your loved one to take care of themselves. The more responsibility they take, the stronger, the better chance they have of having a sustained recovery, but they become stronger and they take more responsibility generally. So I know that particularly in treatment, they leave us with a real mess, and we want to phone the bosses and we want to phone pawn shops and get stuff out the dealers. Try not to get too involved in that because it's too much overwhelming and it's enabling. So do not fix, pay, or pick up the pieces of the carnage of their addiction. Doing this kind of damage control has not helped others get clean. Addicts will find it difficult to patch their lives back together, but disabling them only enables them to either carry on using or relapsing periodically. Your responsibility is to take care of yourself. There's no room for judgment or blame. It is important that we stop all forms of judging and blaming. This includes judging the addict or alcoholic, their using friends, the dealers, the systems, or yourselves. It's not helpful to get stuck in judgment. Blaming keeps people stuck in learned helplessness. We all go through it. We all do it. Where we blame. You know, I remember when he got into that relationship with a girl in 1966, it all went downhill from there. Reality is, one person does not cause an addiction. If the person is predisposed to addiction, if they use it the first time, they like the effect of it, they're going to use. So please avoid judging and blaming because it's the learned helplessness and we really get stuck. There's no movement if we're blaming anybody.
Sheryl, I think I just want to add as well on cleaning up the carnage. Yes, it's enabling, but also like for any addict or alcoholic, it's really important that they feel their consequences and you know, experience their consequences. If my family is going to bail me out every time, I can just get away with it again and again and again. So it's really, really important to stand firm on that and not clean up after their mess. So, for example, bailing them out of jail or, you know, paying, like getting the stuff out the pawn shops, all of that, the person, your loved one is just going to think, well, every time I get into a shitty situation, excuse my language, my family will bail me out, and then this just leads them to thinking, well, it's easier for me to manipulate and have them bail me out than actually feel the consequences.
Yeah.
So that's really important as well.
Yeah, and I think one of the questions we get asked regularly is, do I pay the dealer? You know, they've racked up some debt and the dealer's phoning me and he's threatening me. Do I pay them? My suggestion, and I can tell you this because I've done it, is definitely not.
Yeah.
Don't pay the dealer for many reasons. One is that you're cleaning their debts. So when they get hold of the dealer again, they've got another credit available to them. You're just continuing the cycle of abuse. And generally speaking, most drug dealers factor this in, that people go into rehab owing their money. And by the time this group is finished, each dealer's probably got 2 new clients. So they don't actually lose out. So please do not pay their debts. Okay. No one can heal whilst blame is a dynamic of your coping. The way to stop judging and blaming is to take personal responsibility and live in the here and now. Take stock of what has happened in the past. It's particularly difficult, but shifting your perspective to the present prevents you from getting stuck in the pain of the past. Don't live in the past. It's over. It's done. It was a mess. But dwelling on it is just, it's not going to make things better, and it can't be changed. Reliving the past repeatedly only serves to hurt us and our loved ones, and we really do stay stuck. So the advice that we offer, and I offer this daily, patients and their families, is live for today. Please don't look at yesterday, and don't project in tomorrow. And a lot of the families really struggle with this. Like, somebody will phone. I spoke to a dad a couple of days ago, and he was asking what's going to happen. His child's sort of in about week 3 or 4. What's going to happen when he comes home? I said, well, when's he coming home? No, it's about 6 months. I said to him, I'm not talking about 6 months' time, because I don't know what's going to happen today. Today, he might decide he's leaving, jump the wall, RHT, wants to drink and use. And all that work and preparation is for null, because we have to deal with today. So we teach our patients to live for today. We try and teach our families to live for today. If you want to recover and you want your loved one to recover, start practicing it tonight. How to live in here and now. Don't project forward. Don't future think. Don't live in the past. What can I take responsibility for today? What can I allocate responsibility for today? And how do I learn to let go and let God? And that's a process, that's a workshop for another day. Okay, we're going to probably only get to one more page. Then we're going to have to ask some questions, and maybe we can pick up next week, Christiane, if we don't get finished tonight. Okay, 9 tips to help you back to sanity. Most important is present a united front. The destruction in our families has been happening for a very long time, and we disconnected, and usually only a few members are part of the recovery process. It then becomes easy for the addict to split, draw a division between the soft and the tough members of the unit. If we present a united front, they're unable to do that. We also ask you to present that united front with us, the treatment team, not just Changes, but any treatment that people go through. Reason being, they're so used to splitting. So many of you have heard things like, oh, don't send me to that place. The food is terrible. The counselors are horrible. Last week, we got told that we were racist. The family was told. We get told that we're in it for the money. We get told we don't understand what they're going through. And that's part of splitting. So if you're not happy with us, tell us. Don't have that conversation with your loved one. If they're complaining about us, your stock standard response should be, oh, sounds like something wonderful for you to take to group therapy tomorrow. So give them that responsibility. Don't engage in any gossip, any splitting. United front. Families, treatment team, and anybody involved in their recovery process. Number 2, slow down. Everything happens very fast during active addiction. And as families rush from crisis to crisis, we rush with everything we do because we've been in crisis mode and living in a state of emergency. Stop, breathe, process, surrender, then decide. I think when I had to learn that, it was so alien for me because I used to run on super speed. In those days, we still had the Concorde, and that was my nickname for myself. I'm in Concorde mode. I don't just go from A to B in a Boeing. I must go in the Concorde. And that's what living with addiction is. We fly through everything. Number 3, which is my favorite one, less is more. When it comes to our addicted loved ones, we tend to do more, give more, speak more, spend more. Stop. The more we do, the less your loved one does. This does not help them stay clean and sober. When they're home in particular, less is more. Don't complain, rant, rave, live in the past, rack up the past, because A, we don't live there anymore, but B, it's not conducive. So from now, learn less. I often say to you when you speak to me privately, discuss things in 8 words or less. Anything more, you're going to lose them, and they will win every argument. Okay, number 4. Never, ever make an idle threat or promise. Think carefully about what you're saying, and don't say something that you cannot completely adhere to or follow through. Don't say, I'll kick you out if you use again if you're not going to. You will lose credibility and respect. Follow through with all promises and boundaries. Speak in 8 words or less. We tend to argue relentlessly, overcompensate, beg, lecture, promising and lengthy attempts to communicate. Stop. A loved one will tune it out. They'll walk away. They'll shut down. So if you speak in 8 words or less, you've got a better chance of getting heard. 6, delay gratification. So a couple of you will call us and you'll say to us, he needs his medication. He needs his blanket. He needs his razor. And sure he does. But you don't have to drop everything you're doing and rush across to drop it off. We teach them how to delay gratification from day 1. And there's so many different tools we have in teaching them to delay gratification. But you undo it if we are saying, not today. We'll speak about it tomorrow. We'll address it tomorrow. We'll get back to you later. We do it for a reason, because we're trying to teach the family and the addict to slow things down, because the prime factor of addiction is the inability to delay gratification. Stop. There's absolutely no need to do anything in a hurried, rushed, or frantic manner. This is a tool addicts use to baffle, confuse, and pressurize the families to give in to their demands. So please don't. If it's urgent, the team will phone you and say, we need this, it's important, can you bring it today or tomorrow? But if they phone you and say, come and visit me and please bring me 2 bottles of vape juice. If it's not in your budget, if you're not going to the shops, no, I will bring it in 2 days' time. 7, whose responsibility is it? Take personal responsibility only for yourselves.
Sorry, I just on the delayed gratification, I think my favorite one is everyone comes into treatment and they want to stop smoking and start vaping, and then they'll go and ask for like the most expensive vape on the market.
Yeah.
I find that's a very common one, because no, I'm going to come into rehab, I'm going to stop everything, let me get a very fancy vape.
Yeah. That, and what our patients are doing is they stop the smoking, they buy the vape, and then they can't cope with that. So then they smoke cigarettes and they use the vape when they can't afford cigarettes again. So it's still part of the addict manipulative, destructive cycle. Whose responsibility is it? Take time to figure out the difference between what's your responsibility and your loved one's responsibility. Ask someone who knows what's going on and who's not directly affected by your loved one's addiction to help if necessary. It's actually very simple. Adults should take responsibility for everything they cause or create. 8, no is a complete sentence. Stop justifying and explaining. If you're saying no, stick to it and stop feeling guilty. Boundaries are healthy and even life-saving for an addict or alcoholic. 9, we've processed the importance of support. Don't stop learning, healing, learn everything you possibly can about addiction and recovery. Don't focus on the substance, rather understand the disease. Continue attending family support groups even when you think you don't need it. We have our weekly online meetings. Please don't stop if they finish treatment or even if they should relapse. Okay, so we've got possibly the most important lesson to be achieved from family support groups is learning how to implement and maintain healthy boundaries so that the family's collective stance is one that supports healthy behavior and discourages dysfunction. This support group also connects you with people in similar situations and may be able to help provide you with resources that they have found helpful.